Hello, everyone. We're having some technical difficulties today. I don't know why it has been giving me the unable to join button with Sammy. So I apologize for all that. So we'll hope this works now. And let's see if it works now. Crossing fingers. Let's see. Waiting a couple minutes. Hello, hello. We're waiting for Sammy. We've been having some technical difficulties today. Let's see if I can. All right. Finally. We're waiting for her to accept. Okay, just says waiting for PT Sammy to accept my request. Let's see. Well, it's still not working, but it says unable to join again. Unable to join. Hello, hello. Yeah, it's been okay, there it is. Okay, so it's been quite a weird day because the technology is not on our side. So we're hoping for, okay,
We got it to work.
Oh my God, this was hell.
I know. I'm trying to set it up on my desktop computer. Whatever reason, it will not let me go live on my desktop. I'm not sure why.
Well, we're here, and let's couple breaths because I was getting a little anxious. Anyways, guys, this is Sammy, physical therapist.
Yes.
Today, she's joining us for an IG Live on Moya Moya disease. And welcome to the Brain PT. Thanks for being here. And guys, let me tell you about Sammy. So Sammy and I met at the Neuro Consortium in LA when we were both residents. And I remember the first day of consortium, she was sitting next to me. And nobody knew each other, well, except if you have your co-residents. So I remember like she was next to me, and I would like peek to her iPad to see the notes, because you know they were talking so fast, and I remember that she was sitting next to me. And then on the second Neuro Consortium, that's when we became more friends, and then we went to CSM together. So we became very close friends. So yeah, this is Sammy. She graduated from Honor Health in partnership with NAU in Arizona for her neuro residency. And then she's also a member of the PR and membership committee of the ANPT with me.
Yep.
She's new with us. And she's a neuro nerd. She loves neuro. And a fun fact about her. Tell us a little fun fact about you.
I want you to tell me one first.
What?
What if you could say one fun fact about me, what would it be?
I need to tell a fun fact about you?
Yeah.
Okay, so a fun fact about Sammy is, I would say, She overpacks when she travels. Like overpacks makeup a lot. But tell us a fun fact about you that you want everyone to know before we get started.
Sometimes when people see me, they don't really know my history prior to being a physical therapist, but I served 4 years in the Army. I was active duty. I did a combat tour in Iraq for 12 months, and yeah.
Nice. Nice. So today we're going to talk about Moya Moya. And this is a disease that not a lot of people know about. I didn't know about Moya Moya before residency, and I had one patient with Moya Moya in the neuro ICU when I was at Kaiser Redwood City. So tell us a little bit about Moya Moya. What is Moya Moya?
So, Moya Moya. So, I was also not introduced to Moya Moya either. So, with the NAU Honor Health residency, you do 6 months outpatient. I never experienced a patient with Moya Moya on my outpatient rotation. It was when I was on my acute rotation, is when I first experienced my first patient. I saw the diagnosis, and I didn't know what it was either until my residency. So, that's why I learned more about it. But Moya Moya, it means puff of smoke, and it's named by the Japanese who first described it when it was identified on radiograph, because when you look at it on radiograph, it has like this little fuzzy appearance and it looks like smoke.
Mm-hmm.
This puff of smoke, what it is, these collateral vessels that are forming when the internal carotid arteries are becoming constricted, and your blood needs blood flow. So in return, what it's doing is creating these collateral to allow for appropriate perfusion, still function and do the things that you do on a daily basis. But the big takeaway of what Moya Moya is being able to identify this this puff of smoke from those collaterals that are forming. So
is it like a type of stroke?
Yeah, so I'll go into more depth about what can be identified with people that have Moya Moya. But I think some of the most important characteristics to understand is you start to have this narrowing of the internal carotid arteries bilaterally, and that to compensate, we create those collaterals and the proliferation occurs. So when you're thinking about Moya Moya in general, so there's ways that you want to distinguish it. So when it has Moya Moya, it's been identified on radiograph. It has a distinct appearance of that puff of smoke. Then you can say Moya Moya. But then you can separate Moya into disease or syndrome. So if someone has Moya Moya disease, they're going to have bilateral stenosis of their internal carotid arteries. Mm-hmm. And I don't know why it happens, but it's identified on radiograph or on angiogram that there's bilateral internal carotid artery stenosis. And if it's Moya Moya syndrome, there is going to be presence of known risk factors. So someone might have neurofibromatosis type 1, also known as Recklinghausen syndrome. There's sickle cell disease. There's trisomy 21. There's cardiac or renal disease. There's cranial radiation. So those are risk factors that can say that, okay, they're having these symptoms of Moya Moya, and we have these risk factors. So that's a good way to classify it as Moya syndrome instead of Moya Moya disease.
And I want to show a picture of, you were mentioning, the radiograph, just so people can see how it looks. Let me see if I can actually turn my screen so people can see. So this is how it looks. You see like a puff of smoke. So I just wanted to give you, can you see it?
Yeah, that's it. That's actually a really good presentation of it. So great what there's a grading system. It's called a Suzuki grading system, and it's stages 1 to 6. And in those stages, it kind of tells you how far along somebody's progressed with having Moya Moya. So when you're looking at imaging, I'll go through each one. So stage 1, you're going to have it narrowing of your internal carotid artery. And then stage 2, this is when those Moya Moya vessels start to present themselves. This is in the stage 2 of the Suzuki grading system. And Stage 3, we have progressive internal carotid artery stenosis, and then the collaterals continue to intensify. And then stage 4, this is, to be honest, it's continuing to proliferate, but by stage 6, this is when the internal carotid artery is completely occluded, and then your external carotid artery is taking over in the vertebral basilar artery system. And it's important because if you think of what your internal carotid artery is doing and then what your external carotid artery is doing, your internal carotid artery is responsible for 80% of that perfusion to your brain. So when you lose that, you're relying dependently on that external carotid artery and vertebral basilar system.
Mm-hmm. Mm. So how is it similar to, I mean, this is like, has to do with the perfusion to the brain. Mm-hmm. So how do they present? Is it, because with strokes, it depends on the location of the stroke. So what do we typically see with this puff of smoke? I mean, I cannot say presentation, but like, type of occlusion.
Yeah, of course. So there was one lady in particular that I worked with in the hospital that I wanted to, because I was going to give a talk at the hospital about Moya Moya too as well. And I was trying to, like, any patient with a diagnosis of Moya Moya, I wanted to know more about, like, what were her symptoms? What led her to be in the hospital with me now? And one of the things she told me, she worked at a casino and she's in a smoky environment that's highly polluted. And she was having all these headaches and migraines and thought it was associated from the smoke. But then these headaches progressed to slurred speech. And so she realized that what she had were symptoms of Moya Moya, and it wasn't from the smoke, it was from Moya Moya disease. And until she started having more symptoms and it started progressing more and she started having slurred speech is when she realized there was something more sinister going on.
Mm-hmm.
There's a research article. I actually have it pulled up. So in the 2019 in the Journal of Neurology, there was the largest retrospective study done, published on those with Caucasian descent that had Moya Moya, and they did it on Caucasian descent because it's not common as those that are Japanese and Korean. For Japanese and Korean, 2-to-1 ratio female to male that get it, but for Caucasian descent, it's a little bit higher. It's 3-to-1 ratio for women in comparison to men. But they were looking at, like, what are some of the what can you see with someone that has Moya Moya, and they reviewed 200 patients, and so before Moya Moya was identified, 71.5% of this patient population had a TIA. So yeah, and so let's see what else there was. There was a good spot. 82% had a stroke, and then they had imaging, which helped identify they had Moya. 9.5% suffered from cerebral or subarachnoid hemorrhage. And then 50%, like the lady that I treated, experienced headaches, and infrequently syncope or cognitive deficits were identified, which is really important. So you got to think, like, if you're going to have a patient that has symptoms of cerebral ischemia too before they have their TIA, it really depends on just the region of the brain that's involved, which is self-explanatory. But we have the internal carotid artery and the MCA. Those regions are going to cover the frontal lobe, the parietal lobe, temporal lobe, and hemiparesis, dysarthria, aphasia. Those are all common deficits that our patients can experience.
Okay. Do you see them more often? I mean, in all settings, there's a setting that you might see them, acute care, ICU. What do you think?
I hate saying this because when I was a PT student, it was like frowned upon to hear a professor say it depends. But it does depend. Like, I didn't see anybody. Everyone that I saw was in an acute setting before having surgery to intervene with what they had. Okay. So I'm not going to talk about too much, but for Moya Moya, there's techniques they can do to help proliferation in the brain. Like, they can create these little holes. They're called burr holes. And the burr holes, the whole purpose of them is for there to create more proliferation instead of just them branching off of the collateral, the MCA, like the lenticular striate arteries, and proliferating from there. There's a couple different methods, but I don't know if that pertains too much to us and how it affects our practice.
Mm-hmm. Now, for us PTs or rehab providers, what are some things that you think like we should know? Like, okay, if we get a referral, Moya Moya, what things should we be thinking of?
Yeah. Okay. Uh, there are a couple of really important things that are detrimental to our patients, and crying and hyperventilation are two things that we have to take into account with our patients that have Moya Moya, because crying or hyperventilation lowers your partial pressure of carbon dioxide, and that induces ischemia and vasoconstriction.
So you said crying and hyperventilation.
Yes.
Oh, so don't make your patients cry. Okay.
Yeah. So yeah, crying and hyperventilation, it lowers your carbon dioxide, the partial pressure of carbon dioxide, and induces ischemia. So, and in return causes the vasoconstriction, and their vessels are already constricted. So those are two things that you really need to take into account. And then the other thing is making sure those patients are hydrated, because you have a similar thing where you cause that vasoconstriction of those vessels as well. There's also other things that need to be taken into account, like if your patient's post-op and you're in the acute setting and they have sutures, they should be wearing absorbable sutures, because they need to have effective pain control so they're not having that pain. So they'll use perioperative sedation. They use painless wound dressing techniques. Absorbable sutures should be in place. Yeah.
Yeah, well, I think like that would be really something that, I mean, we're really not, let's say if they have other type of sutures, I think it's just hard for us to like be like, oh, you know, just be aware as a PT, like if you see your patient and they have other type of sutures, they're going to be more pain than someone who has, like Sammy said, the absorbable sutures. But I mean, there's like limited things we can do if they have the other type of sutures. Just make sure with the nurse, you know, that they are getting effective pain medication before you see them.
Yeah. So I think it's important, like if you have a patient with Moya Moya, to not worry too much about what it is that you're doing with them, because you just got to look at it as if it were a patient with a stroke. So then you take into account, like, okay, what tests and measures can I use to work with this patient population? Because the first time I was like, Moya, and it's like, I don't know what this is, so it made me all frazzled. But now if you look, you know, the stroke edge to the task force, they have it laid out for practitioners and physical therapists, like what are we going to do for outcome measures. And there's a couple of good ones that I want to just touch base on really quick for those in the acute setting and those in the inpatient outpatient setting. So if you're in the acute setting, there's 3 highly recommended measures that we can use for this patient population. It's our Orpington prognostic scale. Then we have our postural assessment scale, or you can do the stream. So those are good ones that are highly recommended in this setting. And then if you're going to do, I'm sorry. So for the inpatient or outpatient setting, you also have the stream and the pass are highly recommended. But you also have the Fugel-Meyer test, the Fugel-Meyer assessment, and the functional independence measure, good one too, that's highly recommended. The only thing with that one, it's not free. So, and then the stroke impairment scale is the other one that's highly recommended for those patients who've had a stroke.
Okay. That last one, is it the stroke impact?
Oh, yes.
Oh, okay. Okay. So these are the ones that you can use when you see those patients. Now, let's remember that you can also use the core measures that we already know, right? Your Berg, your 5 times 60 stand, all of those. But yeah, I think those are great for these patients.
Yeah. Trying to think if there's anything else that's good to know about this patient population. I know that with prognosis and getting better, so usually this results in having to have surgery for this patient population. So if these patients have symptoms, research says there's a 2.6% chance of having dramatic progression, which is very low in comparison to if you don't have surgery, and they say 2/3 of patients are going to have some symptomatic progression for a 5-year period. Huge difference if you're able to intervene. And also, so some people are visual learners. The Cincinnati Children's Hospital, they have this amazing video that explains the stages of Moya Moya as well, if anyone's interested. And it kind of shows you like inside the brain, how the internal carotids become constricted, how the vessels proliferate and kind of go on. It's a good watch if anybody's interested.
Yeah, we'll put the link on the caption of the video so people can see it.
Yeah. But yeah, that's it. That's what I got from Moya Moya.
All right, so just to do a little recap. So yeah. Correct me if I'm wrong. So the Moya Moya puff of smoke, it involves the internal carotids. And remember, ACA, MCA, all those branches. The cause, unknown.
So, yep, it can be idiopathic if it's Moya Moya disease, or it can be, if it were to be Moya Moya syndrome. Some known risk factors, like, oh, I didn't mention trisomy 1. So Down syndrome is also a risk factor for developing Moya.
What was that again?
Trisomy 1.
Oh, okay. Okay. And what else? Recap. So we said let's say if you receive a referral for your patient with Moya Moya, don't freak out. This is very similar to a stroke. Don't make your patient cry, literally, because it's not good. It has to do with something with the arteries and sympathetic, parasympathetic. Oops, sorry about that. And no hyperventilation.
Yep.
All right. And then, so outcome measures that you can use, you can guide yourself by looking at the stroke edge. You can find it in the ANPT website. And then you can use the acute care if you're seeing your patient in acute care. Inpatient rehab, very similar to the acute care ones. You're just adding couple more that are appropriate. And am I missing something else?
Trying to see if there's anything else important. No, I think that's everything.
Yeah. All right, let's see if I'm gonna turn on the comments to see if someone has any questions about Moya Moya and PT or rehab related. Let's see if we had any. Nope, not till now. Does anybody have any questions for Sammy?
Well,
let me just tell you about my patient with Moya Moya. Actually, she was, I really don't remember a lot, because it was back then, in 2019, but she was in the ICU, and I mean, she was pretty high level, but I just saw one patient. She didn't have hemiplegia or language problems, communication problems, anything like that. Have you seen any patients with like severe hemiplegia? Does like, do they present like with very significant deficits? What's your experience?
So I only had a couple patients. So I worked at for my residency with NAU and Honor Health, I worked at the stroke center at the hospital, and I only saw a couple patients during my 6 months there.
Mm-hmm.
They were full functioning. They were in the beginning stages, more preventative type stuff because of the disease, and I didn't see anyone that was further progressed, like we talked,
Mm-hmm. Mm-hmm.
unfortunately.
Yeah, mine was also very high level. I'm trying to look to see if there are any like physical therapy recommendations, but I don't see a lot. I can tell you there's very limited research of Moya Moya and PT. When I was at Kaiser, some of my colleagues, they did an in-service on Moya Moya because, I mean, not a lot of people know about this Moya Moya related to like the stroke family, I would say. But I mean, basic things you need to know. It's like a stroke. So,
I think that's a big way to associate Moya Moya with that have strokes, and
mm-hmm,
why we associate it with that, and what the risk factors are, and
mm-hmm,
what they need to do preventatively for
mm-hmm.
their chances of having symptoms. Like living in Arizona, you need to be drinking water anyways. If you have Moya Moya, you really want to avoid dehydration that time, to educate your patients why, instead of them just telling them to do it, so they understand the process of what's happening and what they need to do.
Okay. Okay. So how would you educate your patient on, like, let's say those things that you told us to kind of avoid? What would be like a layman's terms explanation for, why they need to be hydrated, or, why they need to not hyperventilate, which, I mean, in reality, we don't really do it unless we run or, exercise.
Uh,
um, how would you explain to someone, or like, what are your recommendations for like a patient education?
I think for me, like when I work with patients, I'm not the best at layman's terms. Like, so let's say you were my patient, like Miss Jimenez, like your arteries in your brain, like, your vessels are like this. When you're dehydrated, they're like this. Okay. Through. Like I'm very visual too. And some of the things I come up with are kind of silly, but it works for me. And I don't know if patients are just nodding to make me feel better, or if they're actually understanding what I'm saying. But try to explain, like I show them, like, this is what your vessel looks like, this is what it looks like,
When you're
if
dehydrated, creating more pressure.
and your blood's not getting through that small space, and it's even smaller than a normal person because you have Moya Moya. And then being like, oh my gosh, you're right, like I get it. Like sometimes, and I
Mm-hmm.
explained it, and it was good, but it was surprising because when one of the ladies I worked with, she's had it for a while, but when I was telling her about what to do, like hyperventilation is bad, she had never been told that before.
Mm-hmm.
No,
Mm-hmm.
that's really important. That's at least discussed as an education piece when you first see a patient.
Mm-hmm. Mm-hmm. And if you read some evidence, there are more things that you should be careful of not doing. Some silly things. I remember, this sounds very silly, but this was actually in the research. It was something about like blowing on hot food. Um,
But
Not
that's
do that. And literally, the article said like blowing on hot noodles, and I was like, are they joking? But I guess it is true. Um, yeah, yeah. So now I guess the final point that I want to make here is um back to where, your explanation and knowing and making sure that your patients know what you're talking about. Some patients, they don't know what Moya Moya is, even though they know they have Moya Moya. So this applies to all your patients having stroke, having Parkinson's, having MS, having, always make sure that, they understand what, their diagnosis is. And, touch those points that you can touch as a PT, and they start asking questions that are more like physician type of questions that you tell them. But always make sure that your patient knows what's going on, their diagnosis, because I've even had some other cases like your patient or my patient don't even know what a stroke is, but they just know that they had a stroke, or they have Parkinson's, but they have no idea what Parkinson's is. So Moya Moya is one of those that they would be like, oh, okay, I have Moya Moya, but who knows? It's just a weird brain thing. But yeah, always ask.
You bringing that up is really important. So like if your patient has surgery, understanding the type of surgeries they have is actually kind of important, because there is a piece to it. And like for me, like, so I've had surgery before. I had to have surgery on my hip when I was in the military, and I don't remember anything the doctor told me before I was going to surgery. So it's important as physical therapy, if we see what's going on with our patient, that we can educate them surgery, because there's so much going on with our patients that maybe them told once isn't enough. So reinforcing is important. But two techniques that our patients will endure when they have Moya Moya, if they're going to have surgical intervention. There's a direct revascularization technique. And with a direct revascularization technique, I'll give you the very simplified version because it doesn't affect us too much as PTs, but being able to educate our patients. You're going to have immediate results of perfusion for these patients that have this technique done for surgery. So if they do a direct technique, they're going to have they can have like the superficial temporal artery to like the middle cerebral artery. They can do a bypass that way. And if you see that they're doing a direct technique, say, hey, there should be immediate perfusion and abatement of symptoms. But if they were to have something like direct technique, your direct technique does not cause cerebral blood flow immediately. It takes like 6 to 12 months for this patient population. They're not going to wake up surgery and know it's different. Like for kids, because the arteries they're small, the donor sites are really small, they'll do something called a pleocenangiosis. And I guess simply put, like they'll take a little bit out of the skull and they'll push down the artery, and they're going to put the artery down, hoping it grows roots to proliferate to create more collaterals that way. That's what they usually do for children. But yeah, that technique usually takes 6 to 12 months. So if you have a patient that has indirect revascularization technique, 6 to 12 months. If they're doing something direct, they should have immediate results.
Wow. That's great. Yeah, that's great information, because sometimes we just don't know about these procedures unless we see them very often. So that's great. All right, let's check if we have more questions or any questions, because we haven't had any questions from the audience, just from me. I don't see any, but all right. Well, for everyone, this will be posted as always on the page. Feel free to watch it at your own pace, own time. Thank you, Sammy, for joining me today and bringing us this interesting talk about this uncommon diagnosis. Or I don't know if it's uncommon, we just don't see it very,
I the stroke center during my residency, I only saw it a few times, so it is.
Oh, okay. Yeah, I just saw it one time. But anything else that you want to add? No? All right.
Ask more. I would love to talk about it if someone had any questions, but if not, it's okay.
Yeah, if you guys have any questions, just feel free to post your question on the actual post, and we will try to address your question.
Yeah.
All right. Well, good luck studying. And thank you so much for coming in today and joining me.
Bye.
Bye. Bye, everyone.